I'm Louisa Barton with the Horse Talk Show, and we're here at Peterson and Smith Equine Hospital in Ocala, Marion County, Florida, the horse capital of the world. I have a guest here with me, Dr. Cayot from the hospital here. We're going to talk a little bit about smoke inhalation. Obviously been a really big concern in the very disastrous Australian bushfires. Seen a lot of animals rushing from terrible hot fires, and obviously a lot of the horses were affected with smoke inhalation. So a good question to ask Dr. Cayot to start with is what's the best thing to do if your horse is in or around a barn fire or any kind of a fire really and inhales a lot of smoke, and what kind of things should you look for, and how do you know how serious the inhalation is?
Right. Well, that's a good question. So if your horse is around a barn fire, obviously the main point is to get them away from it as best you can. Open the doors, don't try not to run into the fire. That's not a good thing to do, obviously. But then you have to worry about smoke inhalation. So if it's serious and they're close to the fire, you can have burning of the lungs, you can have scarring of the respiratory system and the respiratory tract. That can all lead to chronic problems down the line. And I would liken it to an acute onset of COPD or a heavy kind of situation, because that's what happens in COPD, but it happens over a long period of time. It's a constant irritation of the respiratory tract that develops scarring in the lungs, and then they're not able to exchange oxygen as efficiently as they were before. So same thing can happen in a smoky environment, even if you're not in say a barn fire immediately on your farm or whatever. But even some of these wildfires that we've had around Central Florida, I've been here 18 years. I can remember several cases of there were wildfires and the smoke would drift, into our area. And certainly horses that already have COPD are going to really struggle with that. And you try to, as best you can, avoid that exposure to the smoke. If they are particularly sensitive to it and they haven't shown signs of respiratory distress before because of some chronic problem, it can kind of throw them into an episode. So the way you tell is you look at the horse. How's the horse breathing? Is it breathing normally? Is respiratory rate increased? Is the respiratory effort increased? Meaning they're having to actively inhale or exhale, and you're seeing them, their abdominal cavity typically heave, and that's where that name comes from. And then, as far as I'm concerned, I can listen to the lungs and listen to the sounds that are coming from the lungs, and all that gives gives you an idea of how they're affected. If you wanted to get more on a smaller scale, but a laboratory based, you could certainly do a blood oxygen, but that you'd have to have the horse at more of a clinic, because the oxygen would it dissipates out of the blood quickly. So,
and I was actually going to ask you, at what point do you know that your horse might need hospitalization and maybe to be brought into the clinic?
Well, that would go with a good physical exam, by the attending veterinarian. If this horse is in significant respiratory distress, which they are, horses are typically very it's pretty easy to tell because they are struggling. They aren't quiet or calm. If they're just breathing hard but they're standing calmly, then you're probably okay. But if they're really having an effort and they have almost like an anxiety, you can tell, then that's a situation that you would consider an emergency. And and it may be that they just need to get into a climate controlled area, or they might have to have like a tracheostomy or something like that allows them to breathe easier.
Is there anything you can do for the horse while you're waiting for your veterinarian to come if your horse has inhaled a lot of smoke?
Well, there's not a lot. I mean, obviously, anti-inflammatories you can try. If you have any of those on hand, Banamine, steroid, dexamethasone, any of those things to decrease the initial inflammation that occurs or the irritation. Any of those things will help. Obviously, try to get them in a space where they aren't exposed to the smoke. So if you can get them inside, away from it, to where it's not, not as prevalent, that's great. And, if you're lucky enough to even have an air-conditioned area that you can put them in, that's, of course, ideal. But there aren't too many of those places out there. So, but that's what you can try to do. Any anti-inflammatory deal to try to decrease the body's response to this pollution, basically, is what it is.
Right.
Now,
as far as if a horse has been, let's say a barn has been on fire, or for example in Australia there was nowhere for them to go to get away from it because everything was on fire, is the outcome generally good, and is it something that a veterinarian can get under control fairly quickly once he gets to the horse, or can it be a fatality if it's, I'm sure it can be, if it's extreme, right?
Certainly, absolutely, yeah, it can be. It can go in any different directions. If this horse was on the cusp of having respiratory problems just from being like a COPD horse, then those horses can be pushed, over the edge, so to speak. Depending on how severe how much smoke they did inhale, how hot it was, did they inhale flames or that sort of thing, and the damage that gets done to the respiratory tract, it's difficult to tell acutely. Certainly, you can scope the horse and look at the respiratory tract from basically the head down to the bifurcation at the lung. But what you can't see is the little bronchioles that are in the lung tree itself and how damaged those are. That won't show up acutely typically. That takes a while to show signs, unless you have some kind of bleeding or that sort of thing that you may be able to see, and that would give you some indication that it's more serious. But it's kind of a wait and see, and some horses will recover just fine and go through it, but ones that are kind of on the edge are gonna, that it could push them over, and then you have a problem for the rest of their life if they make it.
So if you have a horse that commonly has the heaves, that horse is obviously going to be compromised much faster than a horse that does not.
Absolutely, absolutely, yeah, because that's just 10 times, 100 times the pollutants or the irritants in the air that they have a hard time with, just humidity and summer pollen.
Yes. It's actually really been tragic to watch the pictures and stories we've seen from Australia. Lots of prayers and thoughts out to everybody connected. It seems they have had some rain now, thankfully. So hopefully that situation's going to improve. I'm here with Dr. Adam Cayot at Peterson and Smith Equine Hospital in Ocala, and I'm Louisa Barton for the Horse Talk Show.